If you are drawing Social Security right now, or you are nearing retirement and getting ready to apply soon, you need to pay very close attention to what has been unfolding in the United States Senate during the last several months. Because the wave of legislative movement tied to Social Security for 2025 and heading into 2026 has been more consequential than retirees have seen in a long time. Some of these changes are already signed and active, and others are moving through Congress with real traction. And every one of them can affect how much money actually reaches your bank account each month. This is not guesswork or partisan drama. These are actual bills, recorded votes, real policy changes, and I am going to explain each one in clear language so that when you finish, you will understand what has already shifted, what is still under debate, and what steps you should take now to protect and increase the benefits you spent your entire working life earning. Let us begin with something basic, because it matters, and because far too many people in Washington discuss Social Security in a way that sounds disconnected from everyday reality. Social Security is not a giveaway. It is not charity. It is not a special favor. It is an agreement. For decades, working Americans paid into the system from every paycheck. The funds were withheld before they ever touched their hands. They had no option to opt out. They paid in during strong economies and weak ones, through recessions and rebounds, through wars and pandemics. And they were assured that once they reached retirement age, that money would be there. For millions of older Americans today, that promise is the dividing line between independence and hardship. According to the Center on Budget and Policy Priorities, using census data without Social Security, roughly 37% of Americans age 65 and older would fall below the poverty line. With Social Security, that figure drops to under 9%. That is not a number to brush aside. That is an eye-opening reality about how vital this program is to daily life for seniors across the country. And yet, year after year, retirees have watched their purchasing power erode. They have watched food costs rise, medication prices climb, housing become heavier and heavier, while their Social Security checks struggled to stay even. The increases they received, what the government calls cost of living adjustments, or COLA, were built on a formula that many economists and advocates have argued for years does not match how seniors really spend. Here is the central issue. The formula the federal government uses to set COLA is called the CPI-W, the Consumer Price Index for urban wage earners and clerical workers. It tracks prices based on the habits of people who are still employed, people whose spending patterns differ greatly from retirees. Working-age households spend a bigger share on transportation, electronics, and entertainment. Retired households put much more of their income toward healthcare, prescription medications, and housing. And healthcare costs, as seniors know from experience, have increased far faster than overall inflation for years. So what happens is this. The government sets annual COLA using a formula that gives too little weight to the categories seniors rely on most, and too much weight to categories they barely buy anymore. The result is that the annual increase retirees receive does not truly cover the cost of living they face. They slip a bit further back each year. The Senior Citizens League released research in October 2025 showing that this gap, compounded over time, has reduced retirees' buying power significantly over the past 20 years. For 2026, the official COLA was 2.8%, which equals about $56 per month for the average retired worker, raising the average monthly benefit to about $2,071. At the same time, the Medicare Part B premium rose to $290 per month, a 9.7% increase, consuming a meaningful portion of that COLA before retirees ever saw it deposited. This is the cycle that has frustrated seniors for years, and it is the cycle that several Senate proposals are now trying to change. The first major legislative action is one that is already law, and if you are a retired public worker, this may apply directly to you. The Social Security Fairness Act was signed on January 5, 2025. This law removed two provisions that had penalized millions of retired public servants for decades: the Windfall Elimination Provision, or WEP, and the Government Pension Offset, or GPO. These provisions impacted about 3 million Americans, including retired teachers, police officers, firefighters, and other government workers in many states who spent part of their careers in pension-covered public jobs and part in private jobs where they paid Social Security taxes. The formulas used to calculate their benefits reduced what they received in ways that were widely viewed as unfair. A retired teacher in Ohio or Texas who also worked part-time for years and paid Social Security taxes on that income could see benefits cut in ways that did not reflect what they contributed. The Fairness Act ended that treatment. It is retroactive to January 2024, meaning December 2023 was the final month WEP and GPO applied. As of March 2026, the Social Security Administration had processed more than 3.1 million retroactive payments, totaling about $17 billion, with an average back payment of around $6,110 per person. However, the rollout has not been perfectly smooth. A March 2026 government executive report noted that some retirees are still waiting for fully recalculated benefits more than a year after the law was signed. If you think you are affected and you have not received the adjustment, contact the Social Security Administration directly. The second major development involves bills currently moving through the Senate that would change the COLA formula itself. The best known is the Boosting Benefits and COLAs for Seniors Act, introduced as Senate Bill 3529 in October 2025. This proposal would replace the CPI-W with the CPI-E, the Consumer Price Index for the elderly. The CPI-E is designed to reflect how older Americans spend, placing more weight on healthcare, prescription drugs, and housing. Advocacy research suggests that if CPI-E had been used during the last 2 decades instead of CPI-W, many retirees would be receiving noticeably higher monthly benefits today. It is important to be clear about where this stands. As of April 2026, the Boosting Benefits and COLAs for Seniors Act has been introduced, but it has not become law. It is a proposal, not a done deal. But the fact that it has drawn bipartisan attention and that several related bills have appeared in both chambers, including the broader Social Security Expansion Act, Senate Bill 770, introduced in February 2025, shows that political pressure has reached a level Congress is finding harder to dismiss. Seniors and advocacy organizations, including AARP, the National Committee to Preserve Social Security and Medicare, and grassroots groups of retired teachers, public workers, and military members have kept steady pressure on lawmakers. Letters, phone calls, crowded town halls, and organized campaigns have changed the political math for senators on both sides. The third key area is long-term solvency, and this is where the discussion becomes more difficult, but absolutely necessary. The Social Security trust funds are under growing financial strain. In February 2026, the Congressional Budget Office issued updated projections showing the Old Age and Survivors Insurance Trust Fund could be depleted by 2032, 1 year sooner than earlier estimates. The Social Security Trustee's latest report projected depletion by 2033. These dates are not identical, but they are close, and the trend is not reassuring. It is critical to understand what depletion means and what it does not. It does not mean Social Security vanishes. Payroll taxes would still come in, but under current law, once reserves are exhausted, benefits would be reduced automatically to match incoming revenue. The CBO estimates that cut could be around 21% to 28% for everyone. For someone receiving $2,000 a month, that could mean losing $400 to $560 every single month. For a fixed-income retiree, that is the difference between paying the electric bill or not, between filling prescriptions or going without. That is why solvency matters, and why some of the toughest debates are happening now. One widely discussed proposal is raising the cap on earnings, subject to Social Security payroll tax. In 2026, the taxable maximum is $184,500. That means someone earning $500,000 a year pays the same dollar amount in Social Security payroll taxes as someone earning $185,500. Income above that cap is not taxed for Social Security. Many advocates and several proposals in Congress, including the Social Security Expansion Act, would apply payroll taxes to earnings above $400,000 or remove the cap entirely. Supporters say this would bring in significant new revenue and extend solvency for decades without cutting benefits. Opponents argue it would be a large tax increase on high earners. The argument continues, but the urgency of this debate is real progress compared with years of delay. Now let us talk about what this means for you in practical terms. If you are already receiving Social Security, the most immediate step is to ensure your information with the Social Security Administration is up to date. Set up or sign in to your My Social Security account at ssa.gov. That portal lets you view your earnings record, benefit estimates, and official notices. If you prefer not to go online, call SSA at 1-800-772-13 Monday through Friday, 8:00 a.m. to 7:00 p.m. Eastern Time, or visit a local field office. Review your earnings record carefully and confirm each year of work is listed correctly. Errors happen more often than people expect, and a missing year or wrong income figure can reduce your benefit. If you find a problem, request a correction right away. If you were affected by WEP or GPO and have not received your recalculated benefit or retroactive payment under the Fairness Act, contact SSA directly. As of early 2026, some cases were still being processed, and bipartisan senators have been urging the agency to speed up payments and honor the full retroactive period back to January 2024. If you are nearing retirement and have not claimed yet, the basic rule still applies. For each year you delay after full retirement age up to age 70, your monthly benefit rises about 8% per year, or 2 to 3 of 1% per month. That is a guaranteed, inflation-adjusted increase that is extremely hard to match in the investment markets. Whether delaying is right depends on health, cash needs, other income, and your spouse's situation. But the legislative changes we discussed, especially the possibility of a more generous COLA formula, suggest the baseline benefit could become more valuable over time, which is another factor to weigh when deciding when to claim. One area that gets far too little focus is the effect on spousal and survivor benefits. When one spouse dies, the surviving spouse usually receives the larger of the two benefits the couple was getting. That means claiming decisions are not only personal choices. They can shape your partner's finances for the rest of their life. With changes being discussed and applied right now, it is more important than ever for couples to plan their Social Security approach together, ideally with help from someone who understands current rules and the changes that may arrive. Let us be blunt about something as well. Seniors did not get progress by sitting quietly. The Social Security Fairness Act did not pass because lawmakers suddenly decided to be generous. It passed because affected retirees and advocates organized, pushed hard, and made ignoring the issue politically impossible. The current momentum behind COLA reform and solvency plans exists for the same reason. Seniors vote in high numbers across party lines, and when they unite on an issue, they are a powerful political force. Every retiree who wrote, called, attended a town hall, or signed a petition helped bring us to this point. There is one more angle worth addressing. Many seniors worry not only about their own checks, but about their children and grandchildren, and whether Social Security will be there for them too. Trust fund projections can sound scary, and they should be taken seriously. But it is also important to remember Social Security has faced solvency problems before, especially in the early 1980s, and Congress acted to stabilize the program. The current legislative drive, if it leads to meaningful changes in revenue, could extend Social Security for decades. That broader goal, protecting the program for today's retirees and future generations, is part of what makes this moment so important. The bottom line is this: major changes are already here. WEP and GPO have been eliminated. Retroactive payments totaling $17 billion have gone out. The 2026 COLA of 2.8% is active, and multiple bills aimed at COLA reform and long-term solvency are moving through Congress with more support than similar ideas have seen in years. Not everything is settled. There are fights ahead, but the direction has changed. The momentum is real, and seniors who stay involved, stay informed, and keep speaking up are why it is happening. You worked your entire life for these benefits. You earned them through labor, sacrifice, and decades of contributions. And the effort to protect and strengthen them is one of the most important efforts of our time. Stay informed. Confirm details through official sources, and make sure the people you care about know what is happening with the program. millions rely on every day.